Today, I'm going to talk about the failure of the UK government to develop a coherent public health policy which addresses the problem of vitamin D insufficiency. Our present policy is not fit for purpose. In fact, it is a disgrace. The English language has 34 words for rain and another 12 for cloud or fog, not counting technical words such as cumulonimbus. 46 words in all. Rain for the British is like snow for the Eskimo. Indeed, our rain and cloud is so pervasive that Scots get little more annual UVB, the wavelength that makes vitamin D, than Eskimos living inside the Arctic Circle. Today, most of us work in offices and don't go out in the sun in the middle of the day when it's strongest, except perhaps at the weekend. We've also been advised to stay out of the sun in the middle of the day for fear of skin cancer. Even nudists, the original sun worshippers, slap on sun cream which blocks the penetration of ultraviolet light into skin, so blocking synthesis of vitamin D, and the result is that almost everyone in the UK gets insufficient vitamin D. When I was a boy, we wore short trousers up to the age of 11 or 12. As you know, boys of all ages today wear long trousers and girls wear tights and leggings, which reduce the amount of sun they get. In addition, television, computers, cars, central heating and air conditioning all encourage indoor living. Furthermore, many cosmetics now contain sunblock that reduces the amount of vitamin D to be obtained by casual exposure of the face and hands to the sun. These changes are probably responsible, at least in part, for the increase in chronic disease which we're seeing now. Multiple sclerosis, diabetes, and asthma have, for example, increased dramatically in the last generation and are now occurring on an epidemic scale. The British Isles as a whole receive less sunshine than most other industrial countries, not just because we are far north, but because we have very cloudy weather. And Scotland has much cloudier weather than England, making it one of the most extreme environments in Europe so far as sunshine is concerned. Here we can see it all on a sunshine map of the UK. The blue and white parts get least sun, and you can see there in the north and west. The sunniest areas, in brown, get about twice as much sunshine as the blue areas, about 1,000 more hours per year. Our weather is cloudy because the prevailing westerly wind brings in dense cloud from the Atlantic. There's little to stop this wet westerly wind from blowing across the lowland corridor linking Glasgow and Edinburgh, where most Scots live, whereas southeastern England gets some protection from the Irish landmass and the mountains of Wales and Cumbria, which draw down precipitation before it's able to cross the country. Summer starts 3 weeks to a month later in Scotland than in England, as any serious gardener will tell you. This histogram shows that UV irradiance in Scotland does not reach the April level of southern England until May. And the southern English get as much sun in September as Scots do in August, because the southern English summer lasts about a month longer. In addition, average air temperatures are of course lower in Scotland, so that people expose less skin. When the weather is considered, it's hardly surprising that Scots are twice as likely as southern English to have a low vitamin D level. This map presents data from Alina Huppinen and colleagues for people aged 45 years. It shows that even in summer, 45% of Scots have a level of vitamin D below 40 nanomoles per litre, a level that may be called deficient. And 75% of Scots fail to reach the 75 nanomole per litre optimum level in summer, compared with 57% of people in southern England. While in winter, 92% of Scots fail to reach the optimum level, compared to 86% of people in southern England. These figures show that vitamin D insufficiency is a very serious problem in all parts of Britain, but Scotland is at the extreme end, and so the overall effects of vitamin D insufficiency are very grave indeed for Scotland. You've probably heard of the French paradox. Well, here is the Scots paradox, better known as the Scottish effect. This graph shows the excess mortality at various ages in Scotland compared with England after correction for deprivation. Mortality of Scots is substantially greater than that of English the English, across all social classes. Epidemiologists studying the Scottish data say that this excess mortality cannot be explained by diet, smoking, or alcohol consumption. Can't be explained by whiskey or deep-fried Mars bars. Why is it that Scots die younger than English people? What are they dying of? Here is a list of causes of death which appear to be more frequent in Scotland compared with England. Heart and blood vessel disease, cancer, fractures, autoimmune disease. Scots have the highest incidence of multiple sclerosis in the world. These are all diseases for which there is evidence that vitamin D insufficiency is a risk factor. So it seems that vitamin D insufficiency could account, at least in part, for the excess mortality of Scots. The high Scots mortality is part of a general north-south trend in disease in Europe. One explanation of this is that the Mediterranean diet contains something special. But Mediterraneans eat almost as much saturated fat as British people. So it can't be that. Red wine, garlic, and vegetables are possible reasons for their better health. But despite much research, we don't yet have an answer that explains all the facts. Something is missing from the story. An explanation not yet explored may be that the Mediterranean sun simply provides more vitamin D over a longer summer season, so blessing the inhabitants of southern Europe with a longer life. What we do know for sure is that insufficient vitamin D is one of the big players in the league of risk factors for chronic disease. It should be in the list of urgent problems recognized by governments, along with smoking, alcohol, obesity, and diet, but it's seldom mentioned. The UK government does have policies on sunshine and vitamin D, but sadly, they are either mistaken or they don't work. The result is an unnecessary early death for many and chronic disease costing billions of pounds. The cost of disease caused by vitamin D insufficiency in the UK has been estimated by Bill Grant, who we heard earlier, at £27 billion annually, several times the annual cost of smoking diseases in the UK, which is only some £6 billion. Now I'm going to look at 5 failures of public health policy on vitamin D in the UK. Failure number 1. Present government policy decrees that healthy adults leading normal lives in the UK need take no vitamin D supplement. This can't possibly be right when we know that in winter 86% of English people and 92% of Scots fail to maintain optimum levels of vitamin D. Failure number 2. Breastfed babies in the UK get very little vitamin D in the first 6 months because breast milk of UK women is deficient in vitamin D. Why? Breast milk isn't all the same. In the UK, mothers generally get very little sun exposure, and so their milk contains very little vitamin D. Mothers and babies need vitamin D in these early months, but mothers are told in official advice from government and midwives that their babies don't need a vitamin D supplement until they're 6 months old. We're the only country in the world giving this advice, which has no scientific foundation. In other countries, the need for vitamin D supplements for babies is well recognized, and babies are started on vitamin D in the first week of life. Provision of a vitamin D supplement from the first few days of life can be expected to reduce the risk of multiple sclerosis and diabetes type 1, but we're failing to do it here in the UK. Failure number 3. This cartoon shows Tony Blair being fed cod liver oil. It's a punishment I devised for him after he joked about the nanny state providing cod liver oil, suggesting it was silly and unnecessary. In fact, provision of cod liver oil to British children in 1942 was part of a heroic wartime effort to feed the nation when we were besieged by German submarines. It was an important advance showing how the state could provide health for all by abolishing rickets, which had been a scourge of the city poor for more than a century. Cod liver oil has been replaced by the government's Healthy Start scheme, which is supposed to provide mothers in need and infants from 6 months to 4 years with vitamin D. The scheme is struggling to recover from an abysmal start. In 2008, after the scheme had been going for some years, the Healthy Start vitamins were still supplied to only about 160 women and about 500 babies in the whole of England. When we consider that some 700,000 babies a year are born in England, you can see that the government's scheme was a farce. It's doing slightly better now. Some 5% of babies are said to be getting the government vitamins in some areas. But this means more than 3 million infants up to age 4 are failing to get the vitamin. I could be polite and say that the government policy just is not working. But it needs to be said that the way this government policy has been designed and implemented shows gross ineptitude. Failure number 4. The only foods to be fortified with vitamin D in the UK are margarine, some breakfast cereals, some processed cheeses, and Petit Filou yogurts. But they contain almost negligible amounts of vitamin D. Milk is not fortified in the UK. The Food Standards Agency appears to be against it, saying that there needs to be assessment. Why? The United States and Canada have had fortified milk since the 1930s. Finland, the Irish Republic, and Jordan have recently introduced fortification of food. Why can't we do it? What's the problem? If an assessment is needed, why hasn't it been done? Fortification does not need to be mandatory. The EU now controls health claims for all member states. A health claim is allowed for foods and supplements providing vitamin D. This should be enough to encourage the food industry to develop fortification of foods on a non-mandatory basis. Regrettably, government has shown no interest in exploring and encouraging this possibility. Now we come to failure number 5. This father and son are disobeying advice given over many years by Cancer Research UK and the British government. The father and son are relaxing in the sun in the middle of the day wearing bathing suits. They are tanned, which dermatologists say is unhealthy. Sadly, Cancer Research UK, backed by the dermatology industry, has given mistaken advice on sun exposure for many years. You'll remember their slogan, "There's no such thing as a healthy tan." Wrong, wrong, wrong. There's no scientific evidence for saying this. We can say with hindsight that such advice must have caused many deaths and the loss of many millions of pounds spent on illness caused by vitamin D insufficiency. And that is advice coming from a cancer charity. Until recently, Cancer Research UK have considered only the risks of sun exposure and ignored the benefits. In fact, they have exaggerated the risks because most, if not all, the risk of melanoma seems to be associated with burning and not with tanning. This shows how advice given by Cancer Research UK has evolved. They used to tell the public to put on sun cream 20 minutes before going into the sun, to stay in the shade, and always cover up between 11 and 3. Then in 2006, Cancer Research UK changed its advice and told people to spend time in the shade and aim to cover up. The advice is less dogmatic, yes, but it simply tells people to do what they're likely to be doing anyway, spending time indoors in the shade, as most of us do in offices and buildings most days. It makes no sense to expose only hands and faces the government and Cancer Research UK have advised in the past. Better to expose more flesh and get more vitamin D. Now Cancer Research UK have realised the folly of their previous advice and have made a U-turn. After pressure from other health charities, they issued new guidance this year and now advise that people should spend some time in the sun in the middle of the day. But what is needed now is corrective advertising from Cancer Research UK, making clear that their old sun avoidance messages were wrong. Here we see Russians sunning themselves at the first opportunity they have in March while snow is still on the ground. They brave chill air temperatures to enjoy the feeling of sun on skin outside the Peter and Paul Fortress in St. Petersburg. In fact, we may even be programmed by evolution to seek the sun, despite all the well-meaning but ill-considered advice to the contrary here in the UK. Consider the humble Panther chameleon, Furcifer pardalis, shown in this picture. Experiments with this creature support my speculation that some animals, including possibly human beings, may be programmed by evolution to seek the sun. Panther chameleons that have eaten crickets dusted with vitamin D powder spend less time in the sun than chameleons given ordinary non-dusted crickets. So perhaps it's not so surprising that people in the UK, who are mostly very low in vitamin D, are inclined to seek the sun when it does come out, despite years of bad advice from government and Cancer Research UK recommending against it. Sometimes we can show that a proposition, or indeed a policy, is false, because it is absurd when taken to its logical conclusion. This is a picture of a child in a sun protection suit, which is the ridiculous result of advice to avoid the sun. Children wearing such a suit, together with sunblock, will quickly become deficient in vitamin D and so put their health at serious risk. This type of clothing, together with coverall swimsuits, has emerged from the advice given in Australia to avoid exposure to the sun, which has been copied here by Cancer Research UK. Perhaps I should be embarrassed to show this picture of an old man without a shirt. But I show it because a lot of people here in the UK have a problem removing just a shirt in their own back garden or in the park. We live on a crowded island and are sensitive about offending others, but we get little sunshine and need to take advantage of it when we can. So my plea is, don't be offended by the naked torso, rejoice in the sun. And I was just talking to David Grimes, who we'll be hearing from later over lunch, and he has an allotment where he does a lot of gardening. And I said, David, do you take your shirt off? And he said, of course I do. But he said, there's two doctors who've got an allotment next to mine, and they wear shirts right down to their wrists, and they came over and counseled me not to do it. I've developed some detailed advice for sunbathing, which I recommend to replace Cancer Research UK's SunSmart advice, which they now admit is wrong. I call it the sun-safe advice because I believe it safeguards health much more effectively than the SunSmart advice. It's safe rather than smart. It encourages people to enjoy the sun safely while avoiding burning. Sunbathing can substantially increase vitamin D gain during the summer, putting you in the best condition to avoid chronic disease, and probably putting you in a position to survive the winter with fewer or less virulent infections. Basically, the sun-safe advice tells people in the UK to sunbathe without sun cream for a few minutes to an hour or more each day, depending on time of day, season, previous exposure, and skin type, and to enjoy the sun, but to take care not to burn. Now, if I have time, I'd like to finish with some celebrity snapshots. Here we have two of the girls allowed after a visit to Thailand. They show two different approaches to sun exposure. Nicola Roberts on the left is a natural redhead who, according to the Daily Mail, shone ghostly white with a touch of pink. She's clearly decided to avoid the sun altogether. Unfortunately, many people have very pale skins in the UK and are deficient in vitamin D because scare stories have made them afraid of the sun. Their pale skins have evolved to make maximum use of the little sun we get, but they're at risk of serious diseases if they get none at all. Nicola's friend, Kimberly Walsh, was, as the Daily Mail put it, the colour of a well-polished Chippendale sideboard. But her tan is so even, it looks as if it's a spray-on product. These products act as a partial sunblock, so I fear that both young women are getting insufficient vitamin D. Here is Gwyneth Paltrow, the 37-year-old star of Shakespeare in Love, Iron Man, and other movies. Like many beautiful women, Miss Paltrow avoided the sun in order to preserve a delicate, pale complexion. A year or so ago, she suffered a severe tibial plateau fracture, and a bone scan showed that she had osteoporosis. Doctors gave her a vitamin D prescription, and she was told to spend more time in the sun. She told fans that the advice left her confused. She said, "I was curious if this was safe, having been told for years to stay away from the sun's dangerous rays." Gwyneth Paltrow is just one of thousands of victims of extreme advice to avoid the sun coming from cancer charities and the dermatology industry. Here is another. Faye Dunaway won an Oscar for the 1976 movie Network. Here she is at 66. As the Daily Mail, sorry to be quoting the Daily Mail all the time, rather than the learned sources that you expect on these occasions, but it's the Daily Mail that monitors some of these interesting human stories. As the Daily Mail puts it, fate has not granted her a handshake to match her timeless smile. She has a beautiful complexion, saved from the sun, and doubtless maintained with expensive creams and surgery. But her hands tell another story. They are racked with arthritis, a painful and progressively crippling disease. Lack of sunshine and insufficient vitamin D are significant factors in causing arthritis, which generally progresses to involve other joints. Arthritis has a low incidence in sunny countries and a north-south gradient. Randomized trials have shown that symptoms of arthritis may be reduced by vitamin D supplements, and progress of the disease is slowed by vitamin D. And here is a tragic story. Jacqueline du Pré was one of the world's most accomplished cellists. Her performance of Elgar's cello concerto had a unique power and haunting beauty. Some believe she was perhaps the greatest talent ever to play the cello. But tragically, she developed multiple sclerosis and stopped playing at the age of 28. She became restricted to a wheelchair and died prematurely at the age of only 42 after some 16 years of illness. MS is a very common disease affecting 1 in 750 people in the UK. In Scotland, MS is even more common, affecting around 1 in 500. Half of those who have suffered from MS for 15 years are unable to walk without help. And after 25 years, half are in a wheelchair. The cost to the UK of this terrible disease is somewhere around £4 billion per year. We know that multiple sclerosis is caused by insufficient sunlight and/or insufficient vitamin D. As a child, Jacqueline du Pré spent many hours practicing her cello. At 11, she won a scholarship which required her to practice 4 hours a day. This must have made it difficult for her to go out in the sun, as most other children do. The dedication that enabled her superb talent to emerge and flourish may also have carried the seeds of her later illness. 4 out of the first 10 men at the London Marathon in 2009 came from Kenya or Ethiopia. Every year they do well. The Kenyan and Ethiopian runners train at high altitude near the equator, where the UVB radiation is intense. So sports doctors are now asking if these athletes may be benefiting not only from a boost to the oxygen carrying capacity of the blood from the altitude training, but also from extra high vitamin D levels. We must all be grateful to Dr. John Cannell of the Vitamin D Council, who researched forgotten scientific evidence showing the importance of vitamin D for sports people. We now know that vitamin D may improve reaction times, muscular strength, balance, coordination, and endurance, as well as reduce risk of winter infections which interrupt training. Maybe we should not be surprised that vitamin D may help athletes when we already know that vitamin D is metabolized into a potent steroid hormone. Some 2 years ago, I drew this research to the attention of Dr. Rod Jacques, Director of Medical Services at the English Institute of Sport. Last October, he told me, vitamin D is now being checked all the time with athletes who suffer any bone injury in the English Institute of Sport. UK athletics have taken it further, as have some wealthy squads, and checked all athletes' midwinter levels too. I feel encouraged that the message is getting out, and I'm hoping that we'll now do better than ever in the coming Olympics. Sir Richard Doll is one of our greatest scientists. Together with Daksha Trivedi and K.T. Kaur, he showed that vitamin D prevented fractures and also found a non-significant but consistent reduction in mortality in those who took it. He was sufficiently impressed by these results to take a vitamin D tablet himself. This was 8 years ago, along with a baby aspirin, which was another part of his routine. I went to see him in 2004 to talk about vitamin D, and one of the memorable things he said was, "This isn't difficult science, we need to have answers." Since then, many answers have been obtained linking vitamin D insufficiency with chronic disease, and some complicated science has emerged, which he would have loved. Now to summarize, the problems are well defined. Science has shown the way. At least 3/4 of the UK population get too little vitamin D. This is the cause of a wide range of chronic disease. Sometimes it is a contributory cause, sometimes it's the primary cause, and sometimes it may be a unique cause. But we can be certain vitamin D insufficiency is a very important cause of disease and death in the British Isles and around the world. Individuals can take their own action to improve their vitamin D levels. But for maximum improvement in health of the nation, government action is needed. We know what to do. Billions of pounds could be saved and much misery prevented. So why isn't it being done? I'll leave you with that rhetorical question, but before I finish, I want to mention 2 books I've written, which are available as free downloads from my website. The first book, Robbery, was published in 2004. It challenged the consensus that we should avoid the sun. It has been influential in changing policy in Australia as well as here. The second book is about Scotland's poor health and its connection to vitamin D insufficiency, and gives substance to some of the things I said earlier today. Thank you for listening.
Thank you very much. Any questions or comments on that?
You mentioned a French paradox and saturated fat, and I was just wondering, how much do you think the campaign, again, to lower the fat intake all across the world, had an impact on the epidemic of vitamin D deficiency? And also, the fact that, we're still trying to reduce cholesterol as much as possible, because I think that's quite a big issue. And the fact that, majority of, general public is advised to drink skimmed milk. Maybe we have to look at this aspect as well, because vitamin D is a fat soluble, and if we don't have any fat in our diet, it would be virtually impossible to absorb any vitamin D.
Well, I'm not up to date on the various fat theories, because I think it depends not just on whether the fat's saturated, but whether you're getting the right polyunsaturated fats and whether you're getting the right fish oil and so forth. But I think Dr. Hollick wants to say something.
Yeah, we actually did studies. We showed that's why vitamin D is now in orange juice in the United States. It's a misconception. You do not need fat to absorb vitamin D. In fact, we did a study and showed that if you take vitamin D with fat, you absorb it less. And the reason is that when you take fat, you don't absorb 100%. And so some of it is lost. And because vitamin D is fat soluble, it hangs on to it. So if you're taking it in any food, it's perfectly bioavailable. So you do not need fat to absorb vitamin D.
You just need to take it with a meal. There is a study which shows that if you take your vitamin D with a meal, you absorb more than if you take it on a between meals.
Yeah, that study, it's only one study, but we've actually done very carefully controlled studies. We've shown that you can put it in corn oil on toast. You can put it in powdered form, on an empty stomach, full stomach. It doesn't make any difference. If you truly look at vitamin D absorption by measuring vitamin D levels after you take it, nobody else has done that. We show that it's no difference.
Thank you very much. Thank you, Oliver.